Hello, and welcome to the protocol review video for the perioperative anticoagulant use for surgery evaluation study, also known as the PAUSE study. The aim of this study is to establish a safe, standardized protocol for the perioperative management of patients with AFib who are taking a novel oral anticoagulant, now referred to as a direct oral anticoagulant or DOAC, and who need an elective surgery or procedure. The study is currently taking place at sites in Canada, the United States, and Europe, with a total enrollment goal of 3,300 patients, or 1,100 per arm. Over the next few minutes, we will be reviewing the PAUSE visit schedule, patient screening and enrollment requirements, surgery risk assessment, the DOAC interruption protocol, day 0 blood collection, and follow-ups and outcomes. A potential participant must be screened and provide consent before being enrolled in the study. The date of enrollment must allow adequate time for the DOAC to be interrupted as per protocol. Enrolling a patient the day before surgery is not permissible because it will not leave enough time for interruption. After enrollment comes the surgery or procedure, with DOAC interruption before procedure as planned. Weekly follow-ups begin 1 week after the surgery or procedure and continue once a week for 4 weeks, resulting in 4 follow-ups total. Follow-up dates are flexible, based on the coordinator's ability to reach the patient or family member by phone. If a patient cannot be reached on day 7, try on days 8, 9, or 10. If a patient cannot be reached on day 10, wait until day 14 and try again to ask the patient about the previous 2 weeks. In this way, some follow-ups may be conducted on the same day. The first form you will complete is a screening and eligibility form. On this form, there are several key fields to keep in mind. First, you must check that the patient is eligible to participate in the study and that this patient gives their consent. The patient must also agree to a day 0 or procedure day blood draw, or else they are excluded from the study. After this, you will collect baseline medical history and surgery or procedure details. Though ideally, all pertinent fields will be complete, the most important information in these sections is what DOAC the patient is receiving, the patient's creatinine clearance, the planned date of the last dose of DOAC before procedure, and the planned date of procedure. The type of planned procedure and also the bleeding risk are necessary. Please bear in mind that the patient's creatinine clearance must be greater than 30 mL per minute to be eligible, or greater than 25 mL per minute if the patient is on a Apixaban. In addition, the PAUSE study does not require a new hemoglobin test to be performed, but does require a hemoglobin value. Please take the patient's most recent hemoglobin value from within the last 6 months. Though the surgery or procedure codes are categorized in our guide as either low or high bleeding risk, a patient's treating physician may reevaluate their level of risk to be inconsistent with our guide. If this occurs, go with the physician's assessment and include a comment that the risk was changed for this patient at their physician's request. Please note that the physician must agree to follow the interruption protocol outlined for the level of reevaluated bleeding risk, or else this patient is discontinued. Using information about the patient's DOAC, creatinine clearance, and bleeding risk, determine the number of days to interrupt DOAC prior to the surgery or procedure. If the patient is taking rivaroxaban or apixaban, creatinine clearance is not used to evaluate DOAC interruption. For both of these DOACs, a low-risk procedure warrants 1 day without DOAC, and a high-risk procedure warrants 2 days without DOAC before procedure. If the patient is taking dabigatran, creatinine clearance is pertinent to evaluating DOAC interruption. If this person's creatinine clearance is greater than 50 and the procedure is low risk, 1 day of DOAC is to be skipped. If the creatinine clearance is less than or equal to 50 and the procedure is low risk, 2 days of DOAC are skipped. If the creatinine clearance is greater than 50 and the procedure is high risk, 2 days of DOAC are also to be skipped. And if the creatinine clearance is less than or equal to 50 and the procedure is high risk, 4 days of DOAC are to be skipped. Please see the DOAC interruption scenarios video for more information and practice scenarios. In all cases, a day without DOAC constitutes 1 full calendar day without DOAC, not 24 hours or a certain number of doses. Thus, 2 low-risk patients on apixaban having surgery on a Tuesday, one having surgery at 8 a.m. and the other at 4 p.m., would both take their last dose of DOAC on Sunday night, effectively skipping 1 day on Monday. When you have determined the interruption protocol, provide the patient with a diary which outlines when to take their last dose of DOAC before procedure and when to resume DOAC post-procedure. Patients having a low bleed risk procedure usually resume DOAC 24 hours post-op. Patients having a high bleed risk procedure usually resume DOAC 48 to 72 hours post-op. In some circumstances, when resumption of an SPAF dose DOAC, for example, dabigatran 150 mg twice daily, is delayed or isn't feasible, there is an option to give 1 to 3 days or longer of a low-dose DOAC or low molecular weight heparin regimen, starting as early as the evening post-surgery or procedure. As mentioned before, the patient must consent to having a study blood sample collected on the day of procedure. If a pre-procedure blood sample is not feasible, collect a post-procedure blood sample as soon as possible. It is very critical that a day 0 blood sample is collected so that we can study main outcomes in our study. Please try your best not to miss any blood sample collections. Pause follow-ups begin 1 week post-procedure. Patients are contacted by telephone once a week for 4 weeks, covering a total of 28 days. During this follow-up period, patients may experience unwanted outcomes, such as bleeding events, thromboembolic events, or death. As soon as you're aware of one of these unfortunate outcomes, complete the corresponding event form, bleed, ATEVT, or death forms, and an adverse event form. Scan and email these forms along with de-identified source documentation to Joanne Duncan. Then enter the event into the REDCap database. This concludes the PAUSE protocol review video. Please take a look at some of our other PAUSE videos, including practice scenarios and frequently asked questions, and an introduction to the REDCap database. Thanks so much for watching!